Tonight, more U.S. troops are joining the battle against Ebola in Africa. They left for West Africa today to help battle the growing epidemic. And here at home, doctors continue to work tonight to save the life of that Dallas nurse infected with the virus. Nina Pham is her name, and she's now listed in good condition. Here's her written statement from this afternoon. "I'm doing well," she says, "and want to thank everyone for their kind wishes and prayers. I'm blessed by the support of family and friends, and I'm blessed," she says, "to be cared for by the best team of doctors and nurses in the world here at the Texas Health Presbyterian Hospital, Dallas," end quote. Experts with the Centers for Disease Control, meantime, are trying to figure out how Pham was infected to make sure it doesn't happen again.
For any hospital anywhere in the country that has a confirmed case of Ebola, we will put a team on the ground within hours with some of the world's leading experts in how to take care of and protect healthcare workers from Ebola infection.
And tonight, the CDC is monitoring 76 other healthcare workers who had direct contact with patient Thomas Eric Duncan before he died last week. Here in Austin, leaders at the Texas Nurses Association say Ebola patients can be well cared for in Texas, and they want to make sure nurses' voices are heard. KXAN's Angie Bevan has more on their reaction, new at 10.
After Dallas nurse Nina Pham contracted Ebola, the CDC said it's time to take a close look at protocols. The Texas Nurse Association agrees. Speaking in Austin Tuesday, leaders say it's important to reevaluate their protective clothing and equipment, making sure it's the best suited for treating an Ebola patient. They also like the CDC's recommendation to have supervisors.
And you're taking care of the patient, that's what you're focused on, is the patient. So someone else watching to make sure that if there's a splash of some sort or whatever, that someone can point that out to you very quickly.
The association's director says they want to keep from putting blame on anyone, especially the infected nurse.
And I think we have certain speak we use in the healthcare arena, and sometimes when that's stated publicly, it's interpreted like that she did something wrong versus that something happened that wasn't expected.
The association wants to make sure nurses look for any problems and speak up when they're concerned.
And the overriding theme here is that when there is a question about process or procedure, our nurses are empowered to ask those questions of their supervisors.
Nurses have a hard job to begin with, and now there's an extra level of vigilance. In Austin, Angie Bevan, KXAN News.
Meantime, NBC's medical correspondent Dr. Nancy Snyderman is now under a mandatory quarantine after she violated a voluntary order. The website, called Planet Princeton, reported that Dr. Snyderman picked up a takeout order from a restaurant in New Jersey. As a result, the New Jersey Department of Health placed Snyderman under a mandatory quarantine until October 22nd. Dr. Snyderman released a statement saying she was deeply sorry for the actions and concerns that that incident caused. And the CDC is clarifying some of the measures it can take to prevent more people from becoming sick. If you're put in isolation, we're told, you're simply separated from people who are not sick. In contrast, if you're held in quarantine, anyone exposed to the disease is separated and restricted from going anywhere. And quarantines, by the way, are extremely rare. The CDC tells us the last large-scale quarantine was enforced during the influenza pandemic in 1918-19. It was known then as the Spanish flu. In 1963, a passenger arriving in the U.S. was placed under a federal quarantine order after a suspected case of smallpox. And since then, we've only found isolated cases. In 2007, a traveler with drug-resistant tuberculosis was placed in isolation. And Austin Travis County Health tells us another person was put in isolation in Texas last year because of a suspected TB case. Well, the dog belonging to that Dallas nurse who contracted Ebola is also in quarantine tonight and being monitored. There is some concern for the health of the dog named Bentley and questions about whether he could be contagious. The Cavalier King Charles Spaniel will be quarantined for at least 21 days.
I want to report that Bentley is doing very well and is doing okay in his environment. Actually gave us some tail wags and happy greetings when he received care both yesterday and today.
Well, some question the expense to care for a dog. Officials say they're getting emails from all over the world, though, from people showing concern and wanting to help.